Good afternoon, everyone. I'm a surgeon, but I don't reject any effective method to treat the keloid. Okay, I'm from China, called Chunhui Xie. Today, my talk is about intralesional treatment strategies for keloids. An operative principle centered on the preservation of healthy skin. Mhm. You can look this picture. There are so many methods to treat the keloid. Maybe someone suddenly look this picture, they say, "Oh, it's great. We have so many methods," but it means that there is a perfect method to treat the keloid. If have, we don't need to discuss. We just do it. The one method is enough. But right now, everyone is not the perfect. And all of these methods can be divided to two types. One of the non-invasive to healthy skin, and the other is invasive to healthy skin. Because like skin graft, fat transportation, flap surgery, these methods all need donor side. We all know the keloid patient, if the skin have damage or a little trauma, it maybe have a new keloid. So even if we do a simple excision, we always use the method of fusiform excision to cut down the dog ear to let the appearance beauty. And the length of the keloid or scar will be longer. So we suggest that if we can do, we choose the non-invasive to healthy skin, just in the keloid. And there is so many non-invasive methods like cryotherapy, but I'm not good at. So I just show about other methods which I good at. Maybe it's truly, maybe it's just I think. The first one is injection. It's from 1960s, maybe more earlier. And always use steroids or 5-FU and so on, other drugs. Like this patient just needs 3 times injection. It can be flight and didn't recurrence. But most of patients didn't have the outcome like that patient. The methods have some adverse reactions like local cutaneous and subcutaneous fat atrophy. Like the Nguyen's patient, the Chinese girl, she has atrophic after injection, and some vascular problems or injection site pain. It's very important for patients. Most of patients cannot continue to do the injection just because of the pain and have some systemic adverse reactions. But in my mind, the method have some indications just for small-sized and early stage keloids or early control of recurrent keloids following prior treatment. If the patient is pregnant or have local infection cancers, we cannot do it. And just do it for 3 to 4 sessions. If with 3 to 4 sessions it cannot to heal, we choose another other methods like laser. We use the laser combined with radiotherapy to treat the keloid. This method is by Dr. Wu Xiaoli in Shanghai. We published a paper. This is my, cannot see it. Anyway, this case is from the paper. The patient with just 1 time laser and 2 times radiotherapy, the electron beam. After 1 year, all of the keloids be flat and not red and not pain, itching, and no recurrence. Even if the thickness of the keloid about 1 centimeter, treated with this method is effective also. This is immediately after post-treatment, and 2 weeks, the wound will be healing. A little red in this time, but don't worry. 7 months, 12 months, 80 months, the appearance is better and better. This case is mine. He is my friend. We pre-treated with pre-treated. The edge of the keloid has a little red and pain and itching. After treatment, 19 months later, the keloid be flat. This patient is very interested. Cheek and chest keloid, just treated with LCR method, laser combined with radiotherapy. After 6 months, he feels better. No pain, no itching. So he asked me, how can I do the tattoo continue? I don't suggest that because tattoo is a minor trauma too. So I don't suggest it, but the patient do it. Fortunately, the patient didn't have recurrence more than 2 years. He is fortunate, but not everyone. This patient is an elder patient treated keloid with skin graft and some other else methods. In my clinic, I treated with laser combined with radiotherapy. This patient is several years ago. The thickness is very thick, so I treated with laser 3 times. After 2 to 3 weeks, the wound healed. Immediately, I treat with the next times laser. 3 times laser after the skin being near flat, so combined with the radiotherapy. After 6 months, 10 months, 29 months, the appearance is better and better. And this method can treat with the recurrence case. Like this patient, the first time I cut down the whole keloid and make a tension release suture and use the tension release tap, but it still recurrence. After 6 months, the first time surgery, I do it use LCR. This immediately, and 1 year later, the keloid didn't recurrence. And the next method is punch therapy. It's very popular in these 2 to 3 years in China because it's a simple method to can do it, and the equipment is very cheap. And now have electrical punch equipment, so we can do the treatment very quickly and simply. Like this patient, the lower keloid looks like a mushroom, so I cut down the whole keloid and suture it. The upper one is not very thick, so I use the punch therapy method. This 1 day later and 3 months and more times, all of the 2 mice, the keloid didn't recurrence. And if the keloid just minor and thinner, we can use just 1 time punch and combined with radiotherapy too. This case is true. This patient be treated with nuclide is strontium 90 several times, but the keloid still grows. In my clinic, I use punch therapy and combined with radiotherapy. 1 year later, have a good outcome. And in Czech, because caused by the acne, the bigger one we cut down it and suture it because it will have a more cosmetic appearance. All of the area post-treatment be a good appearance. Like this is, this patient. This patient with a very huge area keloid and have infection. You can look, this area has a hole with infection. So in the surgery, I first cut down and open the tunnel and clean and wash the infection area. Other areas treated with just a one-time punch. And combined with super X-ray, 18 months later, all of the keloid be flat. And the back of the patient looks like this. Actually, it's a not perfect outcome because the patient even have hyperpigment. But I believe as time goes by, the appearance will be better. And the patient very happy. He said to me, all of the keloid with therapy after treatment, no itching, no pain. It's very important because this patient cannot sleep, cannot on work just because the pain and itching. And the next method is core excision. I showed this last year in Shanghai. Use knife to remove the core tissue of the keloid and leave the skin of keloid and suture to suture it. Like some ear cases, we just remove the core tissue. The keloid like an expander, so the skin is more bigger than the defect after remove the core. So we cut the extra skin like this and suture it 6 months later, 1 year later. And in the operation, we can see we just leave nearly about 1 millimeter thickness skin. So the keloid skin looks like normal skin. It's very soft. In these cases, we do this also. And the thickness of keloid is about 2 centimeters. Cut down it, suture, and 15 months later. This patient is caused by burns, but is a keloid too. And when a patient with keloid in ear, firstly, I need to maintain the normal appearance of ear. Sometimes the patient with just 1 year's keloid, before the operation, I will take photo to the keloid ear and the other healthy ear, because I will do the operation let the keloid ear post treatment looks like the other side healthy ear. This patient post-treatment have a little necrosis, but most of the time it needn't worry about because the wound will heal in 2 to 3 weeks. And combined with radiotherapy, most of them will have a good outcome. In some cases, we do the core excision to the thick keloid to do core excision. The thinner one, we do a punch therapy. Like this is also. Just this keloid we treat with core excision. The other ones we use punch therapy. And maybe John will be happy to hear that all of my patients treat combined with radiotherapy. And in my mind and experience, I think the treatment of keloid has 2 steps. The first step is volume reduction. Use punch, laser, excision, and so on to reduce the volume of keloid. And the second step is to recurrence prevention. The main method for the second step is radiotherapy with superficial X-ray or electron beam. And there is a point is very important. Because I'm a surgeon, only radiotherapists can do the radiotherapy. So surgeon and radiotherapist must maintain a close contact. When I will do a surgery to a patient, before the operation, I will make my own. We will make an appointment to radiotherapist. I will say the patients what happens about the patient. I will do what and how and when to do the radiotherapy and do what doses and what fractions. We will talk each other. It's very important because not every radiotherapist like John or Henry, they like to do the radiotherapy for keloid patient. So all of the method is not used alone. It's a systemic therapy. Like this patient, we in the operation we will cut down the most thicker and some area with infection, and the other areas we will do punch, and combined with radiotherapy, all of the areas. Like this patient, we'll do a systemic therapy. The first step is a limited excision. The limited means that we don't cut down all of the keloid because we cannot do it. We do limit the excision and the operation as limited in the keloid as much as possible. And the second step is injection. Injection some steroids, maybe combined with FU in the just after the limited excision. This method, injection have 2 benefits. The first one is because of the medicine, the sickness or the recurrence rate will be reduced. And the second benefit is that after injection, the keloid will be firm. It can make the next punch therapy be convenient more. So the next step is punch therapy. Punch the other areas. And after operation, the first time maybe in the 24 hours after operation. And pressure therapy is important too. Like this patient will wear the pressure garment 6 months, maybe more than 6 months. It can, because after punch therapy, the keloid cannot be flat immediately. It needs several months to be flat. So the pressure therapy can help the keloid be flat more sooner. And follow-up is important too. I always talk to patients after treatment, 1 week, 1 month, 3 months, 6 months, 1 year, 2 years. You need to come back. Let me see the area after treatment, or take a photo in online to me. If because we cannot do this method, let people's recurrence rate to 0. And summary. This strategy have several advantages. The first one is non-invasive to healthy skin. And the second one is it's a simple method. Maybe it's important because there are so many patients with keloid. Just we need to more doctor to treat it. And this simple method can easy to study and easy to do. And don't need some like micro surgical techniques, microscope, like some expensive equipment. It just don't need. And the third one is a quick recovery. Most of the patients just need 1 week treatment, and sometimes 1 month. Don't need several times like treatment, like injection, 1 month, monthly, one time and more time. Didn't need, just need 1 month or 1 week's treatment and wait. Just wait. If have recurrence, the first immediately we will do some injection or another time radiotherapy. Okay, that's all my talk. I'm so happy to be here to this meeting to Netherlands. Thank you.
Questions for our speaker?
Yeah, thank you for your talk. You do radiotherapy after the treatment. And if there's a recurrence, can you do this treatment again with radiotherapy? You said you can do radiotherapy. How many times can you do this?
Yeah. I agree with the professor. The data is very important. I just forgot to say that. In current data, the patient treated with this strategy, the recurrence rate is about 5 to 10%. So the follow-up, if the patient occur recurrence, immediately I will do the injection. And after 3 or 5 sessions, the keloid be flat and not right is enough. But even I use several sessions injection, cannot control it, I will do another time radiotherapy. After 6 months, more than 6 months, after the first sessions radiotherapy.
Many congratulations. You gave us a wonderful talk with multi-modalities, and I'm very proud of you, what you've all presented. And well, I've got to ask you, what on earth is that in the middle of your slide? What is that? What's that? Yes, what is it?
A Chinese ink painting.
What is it?
Chinese traditional ink painting. Yeah.
It looks like a coconut. It's fantastic. Let me just say one thing. I loved your slides. I love the fact how much you care and like your patients and follow them, because it's not easy. Everyone should know how difficult it is to get follow-up, because they're an itinerant lot. They're often young people. And then the other thing I wanted to tell you is I've had a similar patient with a tattoo, and you did a wonderful result with keloid in a tattoo. Did you notice the keloid was much brighter after you finished and got rid of the keloid? I wonder how that was possible. Have you noticed that on your photographs? The color, the colors in the tattoo were lovely.
Oh, tattoo. Oh, okay.
Tattoo. Yeah, but the colors were good when the keloid went. Did you know that?
Well, he got another tattoo.
He had one across his thing.
He had a second tattoo to add the color after the keloid.
Yeah.
Yeah.
There was a difference.
Yeah.
Right.
I just wanted to draw attention to something I saw in his thing for surgeons. He leaves the outer skin and then takes out the inside so that he can use the outer skin to reduce tension. And I just thought it's something that I should draw attention to because for the other surgeons in the room, because it helps with the reduction of tension, which we all know tension is a problem in keloids.
Any other question? Very good point.
Yeah, so again, the punch technique. So I found it really interesting. It's something that is really not done maybe somewhere else than China. At least I don't know anything about it, but it's funny. And you have this electrical device. Does it punch also smaller punches? Like this again is about 2 millimeter, right? The
Yeah.
punches.
Yeah. I usually use the diameter 2 millimeter or 1.5 millimeter.
Okay, that's the smallest, 1.5.
Yeah.
Okay.
Thank you.
Any other questions? All right.
I think we'll take a break and maybe
Yeah.
more questions out in the hall.
Correct. And one more point I want to mention to you, all of you are invited to dinner. We have a restaurant reserved for a number of us to go after the refreshments, after 6, 7 p.m., whenever it is, together to dinner. Everybody is invited. Thank you very much. Thank you very much. Excellent presented. Thank you. There are a few USB sticks here. If anybody is missing one, please come and get yours. Unfortunately, three are in my hand. I don't know whose they are. The USB sticks.
I take it back.
Yeah, there are 3 of them. So we need to, you want to take a look whose presentations are in who.
I'll show you.
Let's see, make sure.
Oh, I'll show it. I'll give it back to you. if you want.
The wedding is past.
Okay.
Party.